Hello all, we welcome the Medical Director of Wavikar Institute, Dr. Chandrasekhar Wavikar. He's been practicing in Thane for last 26 years. He specializes in refractive and cataract surgeries. He has treated more than thousands of patients so far. And many of his patients are so happy that they consider him as an idol. Recently, he was also bestowed with Thane Gaurav Award from Thane Municipal Corporation. Let's talk with a doctor who has a different eyesight, Dr. Chandrasekhar Wavikar. Welcome, doctor.
Thank you, Nikhil, for the kind introduction.
Doctor, very few people like spectacles. Like many people, they don't like spectacles, and in many professions, people with spectacles are not welcomed. So, what is the solution for them?
See, there are many professions like sports, hospitality industry, contact sports especially, where specs are not welcome. We have solutions for that, and the bouquet of those surgeries is called refractive surgeries. So the prominent of them is Lasik, but there are other surgeries like ICL and Prelex where Lasik is not suitable for them.
So, many people are very inquisitive to know what is Lasik. What is Lasik according to you?
See, Lasik is a procedure by which we get rid of number or the spectacles. Lasik is the most commonly performed refractive surgery all over the world because it has got a very high success rate. The predictability is excellent, and the safety profile wise also it scores much better than other procedures. Now we have an eye model here. This is our eye, like we are divided into two parts for you to understand. This is the front side of the eye and this is the back side of the eye. In the front there are two lenses, okay. This is the central lens in the center, and the outside is the cornea. What we do is in Lasik is that we change the shape of the cornea, because of which the refraction of the eye changes, okay, and patient can see clearly without glasses.
Sir, according to you, who can undergo Lasik and who cannot?
For Lasik, the minimum criteria is that the person has to be at least 18 years old and the number should be constant for 1 year. He should be off contact lenses for minimum 1 week, and the person should not be taking any medications. Some of the medications, they have effect on the result of Lasik, so we cannot do Lasik if person is taking some kind of medical treatment. So the patient should tell in detail what treatment he is taking before he undergoes Lasik. Similarly, Lasik cannot be done while during pregnancy and when nursing a baby. There are some eye conditions also where Lasik cannot be done. So for that, what we do is called Lasik workup. That means it is a short term used for battery of tests. We come to know many things about the eye, like corneal thickness, curvature, shape of the curvature, aberrations of the eye, etc., which let us know whether a particular person is suitable for Lasik or not.
But how is Lasik performed? Like, what is the procedure of Lasik?
See, a lot of patients have apprehensions about the procedure, but actually Lasik per eye, it takes hardly 3 to 5 minutes. We put some anesthetic drops in the eye, okay, and then we perform the procedure. A clip is placed in the eye because a patient cannot blink. We do not give any injection, there is no bleeding, no stitches are taken. After surgery, not even pad is given, and patient goes home within 10-15 minutes. Lasik is a fairly pain-free procedure.
Sir, we understood the procedure. Now, can you please explain us the types of Lasik?
See, Lasik can be classified by two means. Number one, the way a flap is created. Now, what is flap being created? Suppose this is the cornea. First, we allow a blade to pass, okay, and raise a flap. We fire laser on that, and the flap is placed back. This is the Lasik procedure, the theoretical part. Now, this flap can be created by 2-3 ways. The oldest method is a microkeratome, that is a metallic blade is used, okay, which actually shears across the cornea and raises the flap. But the latest bladeless Lasik is far more superior in terms of safety profile and quality of the flap. In that, We are using femtosecond laser which goes through the cornea but at the desired depth and raises the flap. So this is called as a bladeless, not bloodless. This is called a bladeless LASIK, and the first one is the LASIK with blade. Okay. Then depending upon the type of ablation, that means the way laser is fired, excimer laser is fired, there is another classification. What is excimer laser? Excimer laser is the laser which is used to change the shape of the cornea. The laser which I mentioned before is the femtosecond laser which is used to raise the flap. Now we are talking about excimer laser. When a ray of light passes through the eye, it undergoes macro deviation and micro deviations. These macro deviations or the big deviations can be treated by the help of glasses as well as excimer laser. But the micro or the minute deviations cannot be treated with glasses, but they can be treated with excimer laser because the excimer laser spot size is very small. When we treat only the refractive error, we call it aspheric or wavefront optimized LASIK. When we treat the micro deviations also, we call it custom LASIK. Okay. Now, to give you an example, how to delete these aberrations, or the very specific term is higher order aberrations. If you Google it, how Andromeda galaxy scientists used to see before Hubble telescope and with Hubble telescope, you will understand the difference between what is wavefront optimized LASIK and aspheric LASIK. In Hubble telescope, all the stray light was eliminated and you could see a much sharper image. So basically with custom LASIK, you are getting much better quality of vision.
Many a times we have heard about Contoura. I think it is also one of the types of LASIK. So can you please explain about Contoura? What does Contoura mean?
See, Contoura is again custom LASIK, but custom LASIK, if you see the evolution, we can divide it into two parts. Previously, what custom LASIK we had was not based on arithmetic or mathematical formulas, and the result was somewhat approximate, even though even then patients were benefited. But we did not know exactly who is going to get benefited and how much. In Contoura, we are measuring higher order aberrations or the micro deviations which are arising out of the cornea, the outer lens. Okay, and along with the number, we are treating specifically those measured deviations. So Contoura appears to be much more scientific. I have been doing Contoura for more than 1 year now. It has been available to the world for more than 3 years now, and it definitely gives better quality of vision.
Many times people are very scared of such kind of procedure. So how risky it is, how safe it is? Can you please elaborate on it?
LASIK is one of the safest surgeries performed today all over the world. LASIK has been approved by US FDA, that is United States Food and Drug Administration, even for army people and fighter pilot planes. So it must be definitely very safe. The complication rates are very, very low. But what is important is that even if person develop complications, the treatment is fairly easy and patient can have full vision. The commonest complication of LASIK is the number being left behind. Okay, so sometimes we have to redo LASIK after a gap of 3 months. The incidence of this is around 1 in 1,000. That means suppose 1,000 patients undergo LASIK in a particular center, normally one person requires second treatment, and 999 the number is quite within normal limits. Now again, when I say 0, it is not necessary that everybody will get 0. Slight number may be left behind, but as long as the person does not require glasses, that's fine. So we don't say get rid of glasses, we say get independence from glasses. There are other complications of LASIK like flap complications, halos, night vision problems, problems while working on the computer, dryness. Most of these complications are temporary and easily treatable.
But if a particular patient or a person, if he is not suitable with LASIK, then what are the other options available?
See, that is what I was referring to when I said refractive surgeries. LASIK is the best, but in all patients LASIK is not suitable. Then we do more tests and then we do surgeries if the patient is found suitable. And the second best option is ICL, that is implantable contact lens. Now there are some patients in whom this is not the second best option, but for the time being let us take it this way. ICL stands for implantable contact lens. Let us see it on the model. Now, as you know, this is the model of the eye and this is the cornea on which I changed the shape for LASIK. Now, backside there is a lens, inside there is a lens, and this is the iris. The aperture size changes with the amount of light falling on the eye, what you call a shutter in a camera. So, between this shutter or the iris and this lens, there is a space. We put a lens inside that space and that we call ICL. That is implantable contact lens.
Sir, are there any complications in ICL?
See, every surgical procedure has complications. If somebody is saying that he is not getting complications, that means he is either not operating or he is lying. ICL also has complications, but even then it is a very, very safe surgery. Like I have been doing ICL for last 23 years and hardly anybody is unhappy. The commonest complication of LASIK is a sizing error. That means the size is not chosen properly. Choosing size of a ICL is a challenge, and as compared to the amount of difficulty we had around 20 years back, today the difficulty has certainly decreased. Okay, but sizing can still be a problem. Of course, there is a solution for that. Then some patient can develop glaucoma and cataract, but these complications are very, very low.
In refractive surgery, you mentioned about LASIK as well as ICL. Is there anything else, other procedure which is included in the refractive?
Yes, of course. We have got PRELEX. Okay, PRELEX stands for presbyopic lens exchange. Now let me explain to you on a model. See, as I explained that here was the cornea and this is the diaphragm, which is the sphincter. Okay, and then there is a lens. When this lens becomes opaque, we call it a cataract. What happened is that initially we were not very sure of getting zero number after cataract surgery, but now we are pretty much sure. So what has happened is that a new surgery has been evolved where LASIK and ICL are not suitable. We replace this lens with an artificial lens. The way do it in cataract surgery. So whenever this lens gets opaque, we call it cataract, and the surgery we do is called cataract surgery with lens implantation. Whenever this lens is not opaque, we do the same surgery, but we call it PRELEX. So that time the intention of this surgery is to get rid of glasses. This is most suitable for people with high number after the age of 40 or people with very high number at any age. But people with high number, there are high chances of retinal detachment. Now, as you know very well that cataract surgery is very, very safe and the complications are very less. Same thing applies to PRELEX, that it is very, very safe, okay, and complications are very less. But the lens which we implant in the eye, in PRELEX we implant a trifocal or a quadrifocal lens. This lens has got its own complications, or rather than complications, you can say side effects, like glares and halos while driving at night, difficulty in reading in dim light, dryness of eyes has to be treated earlier, etc. So we have to do some tests to understand what are the chances of a particular person developing these problems, and when the person we realize that the chances are pretty less, we explain these things to the patient and go ahead with prelex. Prelex is also a very highly rewarding surgery.
Doctor, we are very happy that you have explained all the refractive procedures. Now, can you please tell us the upcoming new branch of ophthalmology, keratoconus?
Keratoconus started coming into picture because people who have got keratoconus, they are not suitable candidates for Lasik. Now, in keratoconus, what happens? Let's see. Eye has got its own pressure, and the cornea, the lens in the front, is supposed to take up that pressure. Some people have inherently weak cornea, so it cannot take up that pressure, and the cornea starts bulging forward and it becomes like a cone, and that is why it is called keratoconus. Kerato is a Greek term for cornea, and conus is cone. You can understand, ice cream cone. So in keratoconus, the cornea becomes conical, and there is a definite disturbance in the quality of vision. People get very odd number of glasses, and keratoconus management has got two aspects. Number one is increasing the strength of the cornea so that it does not bulge forward, and second thing is that improving the quality of vision or getting rid of number. Now, increasing the strength of the cornea, for that we do a procedure called C3R, or corneal cross linking. Okay, in that what we do, we put riboflavin eye drops in the eye. As they penetrate the cornea, after that we give ultraviolet light. This ultraviolet light and the riboflavin, they interact with the corneal tissue and increase the strength of the cornea. Then coming to the treatment, usually we have to wait for something like 6 months before we improve the quality of vision, or we can think of improving the quality of vision. The simplest treatment is of course glasses. In some patients, glasses are not suitable, so we give contact lenses. There are very high quality specialty contact lenses available who can fit on these irregular corneas. If that is not done, then surgery is available. So surgery, ICL I already explained. Besides that, there are some intracorneal rings which we put when the keratoconus is really asymmetric and we want to centralize it. And there are some keratoplasty where we have to replace the cornea when the cornea has become really opaque.